Good evening and welcome back to CNN Money Switzerland. I'm Olivia Chang. It's time to take a look at the top stories for tonight. Starting with our main story, a first batch of the Moderna coronavirus vaccine could be ready by December. Swiss-based Lonza is tasked with the mass production of the vaccine. Now, earlier, my colleague Hannah Wise spoke to its interim CEO and chairman, Albert Benny, who says the vaccine will be initially made in the US with a production line also planned for Switzerland. Take a listen.
First of all, I don't know how the clinical phases 2 and 3 will evolve. We don't know when the FDA will give, hopefully, the green light for the vaccine. And as I said, Lonza is not in charge of the clinical phases. We are in charge of scaling up a manufacturing process and delivering the drug substance. So all questions in it related to the clinical phases and their evolution should be addressed to Moderna.
But what kind of timescale are you working towards then when you think about scaling up the process?
So we are expecting in North America, with the first manufacturing line, to be able to produce the first batch for commercial volume in December 2020. This is our current goal.
And how much of the vaccine will initially be produced?
Well, that depends on how many manufacturing lines will be installed. So I don't have the answer today. We start with one manufacturing line in North America. We are starting to install also a second manufacturing line in Visp, Switzerland. And Moderna is also preparing 1 or 2 manufacturing lines in North America.
So in the grand scheme of things, once production starts, it will happen not just in North America where it will start, but it will also happen here in Switzerland as well.
This is correct, with roughly 1 month of delay versus North America.
And how is all this being funded?
Well, the current clinical phases 2 and 3 have been funded by BARDA in North America, as well as the production line in North America. The manufacturing line in Switzerland in Visp will be funded by Lonza itself. We decided that we have to participate to this exercise, to this obligation, basically, to develop a vaccine for the world, for the society. And this would be our contribution to the worldwide society to invest in a manufacturing line in Switzerland.
And how much money are you putting towards that then?
Well, we don't say too much, but basically one manufacturing line, the investment will be around 60 to 70 million Swiss francs for a manufacturing line.
For one?
For one.
And how many vaccines can that produce per day?
Well, it depends on the dose, which will be selected at the end of clinical phases 3. So depending on the dose, we may be able to produce by manufacturing line between 50 to 100 million doses a year. It depends on the dose, which will be decided at the end of clinical phase 3.
Now, earlier this week, it was announced that one of your board members was actually leaving Lonza to go and join the vaccine advisor service as part of the US government. Is there any connection with that and your vaccine development efforts?
No, it's a pure hazard. Mr. Moncef Slaoui was a board member of Moderna, was also a board member of Lonza, and of course, with this nomination, he was obliged basically to step out of these 2 mandates. This is pure hazard, nothing special on that.
And has Moderna had any discussions with the US government about who gets access to the vaccine first?
That I don't know. This question should be asked to Moderna, because Moderna will be owning the vaccine, and they have then the freedom to some extent to decide where the vaccine will be distributed. We are not involved in these discussions.
I mean, there's a lot of controversy, though, going around, especially with Sanofi, for example, the French-based vaccine, and the CEO says that will go to the US first.
I can't comment. I repeat it. The owner of the vaccine will be Moderna, and this is the responsibility of Moderna to decide where the vaccine will go later on.
But in a more general context, when you think about the UNAIDS and Oxfam warning that the world cannot they can't afford the monopolies and competition, to stand in the way of a universal vaccine needed to save lives? I mean, do you have concerns about distribution of such a vaccine?
Well, first of all, it is impossible for one nation to be able to develop hundreds of millions of doses a year of this vaccine. You need to have access to the capacities, to the manufacturing facilities, and don't forget at the end, when the vaccine is produced, it goes into vials. You will need billions of glass vials and billions of stoppers. So if you combine what you need to produce hundreds of millions of doses, you realize that you need to join forces. The best example is basically a Swiss company joining forces with an American company to be able to develop the manufacturing processes and to develop successfully manufacturing processes. So it can't be only one nation exercise.
The virtual meeting of the World Health Assembly has entered its second day. Here's a look at what Tedros Ghebreyesus, Director General of the World Health Organization, had to say about countries getting back up and running.
WHO fully understands and supports the desire of countries to get back on their feet and back to work. It's precisely because we want the fastest possible global recovery that we urge countries to proceed with caution. Countries that move too fast without putting in place the public health architecture to detect and suppress transmission run a real risk of handicapping their own recovery. Early serology studies are painting a consistent picture. Even in the worst affected regions, the proportion of the population with the telltale antibodies is no more than 20%, and in most places, less than 10%. In other words, the majority of the world's population remains susceptible to this virus. The risk remains high, and we have a long road to travel.
Now, Swiss telecom companies Salt and Sunrise have teamed up in a new venture. Over the next 5 to 7 years, both players hope to bring fibre-based broadband services to about 1.5 million Swiss households. That essentially means high-speed internet, especially in undersupplied suburban areas. The rollout will start by the end of 2020, with the initiative costing about 3 billion Swiss francs. Also, Julius Baer has delivered results from the first 4 months of 2020. The bank says the coronavirus-fueled trading frenzy boosted its profitability even as a sell-off eroded assets under management. Now that fell 8% year-on-year by the end of April. CEO Philipp Rickenbacher said it was, quote, clearly too early to assess with any certainty the impact of the crisis on financial markets and the bank's performance for the rest of 2020. Swiss hearing aid maker Sonova is also holding back from delivering its outlook for the current financial year. That's down to the ongoing pandemic as well as the uncertainty. Since March, the crisis has dented the company's performance, with the number of cochlear implant surgeries also dropping. Nonetheless, sales in the past financial year did rise 5.6% in Swiss francs. The company maintains that, quote, the attractive fundamentals of the hearing care market remain very much intact. Finishing up, SBB said today that it will be waiving rents from businesses impacted by the shutdown. This will mainly help out shops and restaurants in train stations across the country. In the meantime, stores that were allowed to keep their doors open will have their rents reduced. Swiss Attorney General Michael Lauber has a meeting with lawmakers tomorrow, and it could lead to his impeachment. The panel will question Mr. Lauber over his handling of the FIFA corruption investigation. Mark Peath, a criminal law professor at Basel University, says the case has been an international embarrassment for Switzerland, and that a decision to go ahead with impeachment proceedings could be a first for the country.
Impeaching is a political decision. The only problem is these members of parliament, they're kind of shy. You know, Switzerland has a parliament that is made up of, well, amateurs, I must say. They have a profession, and they don't necessarily fully understand what they're doing.
Italy's Lombardy region has been hit hardest by the virus, and it's only now just beginning to reopen. The virus has devastated Lombardy's nursing homes, with many elderly patients dying alone. CNN's Ben Wiedemann has the latest.
The lockdown is over in the cemetery of Nembro in northern Italy. Giacomo Boffelli succumbed to coronavirus on the 11th of March, but only now can family and friends say farewell. Her voice breaking, his daughter Nicoletta says goodbye. But we never abandoned you. We never would, she says, because you'll always be in our hearts. This community in the foothills of the Alps suffered one of Italy's highest per capita death tolls. It was as if a tsunami overwhelmed us, especially the oldest people, Nicoletta tells me. The average age of those who died from coronavirus in Italy is 80. For the town of Nembro, the month of March was a month of daily death. You just need to look at the death notices here. This woman died on the 7th of March. This man died on the 8th of March. This woman died on the 7th of March. This woman on the 9th of March. This man on the 7th. Of Nembro's main nursing home's original 87 residents, 34 died from the virus, the first on the 19th of February. But it took provincial health authorities more than a month and a half to test anyone in this home. The very first swabs done here were the 10th of April, says nursing home director Barbara Codalli. It's been more than a month since any COVID deaths have occurred here. Now relatives can visit their loved ones again at a distance. But the situation remains precarious for the elderly in Milan's nursing homes, where the death toll has been described as a massacre. She's also dying without oxygen because we don't have machines, says a nurse who shot this cell phone video. We muffled her voice because she fears for her job. As the pandemic intensified, the staff at the Palazzolo nursing home assured Carla Porfirio every day her 85-year-old mother Michela was fine. On Sunday, April 5th, Carla called the nursing home. They said her mother was on oxygen and morphine. The next day, Michela died. What's so tragic, says Carla, for those of us who lost our loved ones, we didn't have the possibility not just to see them for more than a month, but we also couldn't be close to them in their last days as they suffered. They needed the hand of their loved ones, and not just that, we couldn't even hold funerals.
Loro avevano bisogno di questa mano del proprio caro.
As the pandemic intensified, the Lombardy regional government asked nursing homes to accept COVID patients, which may have contributed to the high mortality rates in the homes. The regional government declined our request for comment, responding that the matter is under investigation. Alessandro Azzoni's mother, Marisa, was in Milan's Trivulzio care home. She's now in hospital with coronavirus in critical condition. He shows me how sections of her care home, marked in red, were turned into COVID wards. Alessandro has founded a group demanding an investigation into nursing homes.
Persone che vanno rimesse al centro.
The elderly, says Alessandro, are part of society with a memory. They gave us life. We can't just throw them away.
Alla memoria.
In a corner of Milan's main cemetery, more than 120 fresh graves. Here too, most were old, most were in nursing homes. This is where the unclaimed dead from coronavirus are buried. Unclaimed because many of them had no family. They died alone with no one to mourn their passing. Small plastic crosses mark the end of lives lost.
That's it for now. Remember, if you want to follow any of our coverage, you can simply head over to cnnmoney.ch for all the latest. In the meantime, take care, stay safe, and we will see you very shortly. Good evening.